We are going to discuss MRI safety today. We will be going live with our MRI machine later this fall that's going to service our patients Monday through Friday. As a staff member, it is important that you understand what the MRI does and safety factors that need to be considered before entering the MRI area. This is to keep you, our staff, safe and make sure that you're able to keep our patients safe. This is what an MRI machine will look like. There is a bed in which we would be placing the patient. There is a magnet that is used to capture images of the patient. This is at the core of the machine. MRI does not produce radiation. Instead, it uses the magnet to separate the protons to capture a picture. It's important for you to know that the magnet in the MRI is always on. Because the MRI magnet is always on, anything that is magnetic will be attracted to the magnet in the MRI. As a staff member, it is important that you remove all potentially magnetic material from your pockets and person before entering the magnet zone, which is zone 4. Keys, wallets, cell phones, watches, and other magnetic removable items must be taken off of your person by zone 3. You will not be granted access to zone 4 if this has not happened. These pictures show the importance of making sure we do not take anything that is magnetic into the MRI area. Wheelchairs, patient devices, and beds have all been stuck to the magnet. If there is a person between the equipment and the magnet, they will get pinned to the magnet and could suffer life-threatening injuries. There will be equipment, such as a stretcher and a wheelchair, that are designated for MRI use only because they are not magnetic and do not pose a safety risk. Should you respond to a fire in the MRI area, it is important that you only use a white fire extinguisher. They aren't white because they're pretty, they're white because they are not magnetic. Red fire extinguishers will be sucked into the magnet upon entry to zone 4. If you respond with a red extinguisher, not only could you be placing yourself and others in harm by the magnetic force, but you will not be able to extinguish the fire you were responding to, potentially causing greater harm. There will be a white fire extinguisher in the MRI area. Any staff member that could potentially respond to emergencies in MRI or will be taking patients back to MRI must fill out an MRI screening form. This form will assess your risk for harm by entering the MRI area. These forms will be filled out annually by staff members who may respond to the MRI area. Should you have any surgeries or updates to your health, it is important that you let Barbara Rose know in diagnostic imaging so you can fill out a new screening form. Never hesitate to ask if it is safe for you to enter. Patients will also need to be screened before being able to have an MRI. Never hesitate to ask questions about the MRI or if you are safe to respond. Diagnostic imaging staff will assist you, but never fear. This MRI machine will improve access to necessary healthcare services for our patients and improve patient outcomes. If you have any questions, please reach out to Megan Corby in clinical education or to diagnostic imaging. Thank you.